Hello, this is Dr. Sheela Gajapathy from Cloudnine Bellandur unit. I'm just going to talk to you about menstrual bleeding and heavy menstrual bleeding today. Heavy menstrual bleeding, which means that the patient has heavy bleeding during her regular menstrual periods or any time in between the cycles or prolonged cycles. 10 to 15% of the women in the reproductive age group have heavy menstrual bleeding. What exactly does it mean? A heavy flow, which means more than 80 ml of menstrual blood loss, or prolonged for more than their usual bleeding days, for example more than 9 days, or soaking more than one pad within 3 hours, or need to change the pad during the night time, more than 21 pads during the regular menstrual cycle, passing large clots. These are some of the definitions to state whether the woman is having a heavy menstrual bleeding. There are multiple reasons why the women can have heavy menstrual bleeding. Some of them are fibroids in the uterus, polyps in the uterus, polyps in the cervical cavity, hypothyroidism, hyperprolactinemias, miscarriages, and hormonal imbalances. Yes, stress can definitely alter the hormonal pattern during the regular days in a woman, and that can also be one of the major and commonest cause why a woman has a heavy menstrual bleeding. The other causes why a woman can have a heavy menstrual bleeding is common infection, pelvic infection like vaginal discharges, cervical discharges, or infection of the cervix, infection of the vagina. These are some of the reasons why the woman can have a heavy menstrual flow. The symptoms as such the women can usually present to us are feeling giddy, heavy, need to change the pad very frequently than the usual pattern, or need to change the pad during the night time are some of the complaints they present to us. So the women typically are feeling very weak, lethargic, not able to carry out their routine activities. It definitely impacts hugely on their quality of life, and because of the need to change regularly their pads. There are various ways that we can do to investigate why exactly there is a heavy menstrual bleeding. We typically ask the patients to get done their ultrasound to rule out any structural causes like fibroids, adenomyosis. We ask them also to get the blood investigations like blood counts, hemoglobin, or platelet count, as well as the bleeding profile, PTINR, BTCT. Those are some of the investigations we carry out to see. And definitely the thyroid hormone profile is something important that we cannot miss, and some of the investigations we can consider. The treatment wise, we do have medical management as well as surgical management depending on the investigation's outcome. Medically, to stop the heavy menstrual flow, we do have medical drugs that can be used to control the flow for a certain period of time, and then based on the investigations we can have surgical managements to take care of the underlying causes.